Hello and welcome to Inside Edition to discuss national, regional and international issues in depth. D.A.R.E is the symbol for the Drug Abuse Resistance Education Program, which works in partnership with police officers, parents and schools. With each passing year, D.A.R.E's success was seen in classrooms and homes, leading to rapid growth and expansion. As each decade passes and success increased, the challenges facing children and families also grew. Bahrain anti-violence program together has been implemented in many schools to teach students good decision-making skills to help them lead safe and healthy lives. Today's episode will shed light on Bahrain's efforts to combat drug abuse and the role of Maan, or Together program, to fight violence and drug addiction. We will be discussing the matter with the program's director, Ali Ahmed Amini. But first, this report for more.
Addiction is a chronic disease characterized by drug seeking and use that is compulsive or difficult to control, despite harmful consequences. The initial decision to take drugs is voluntary for most people, but repeated drug use can lead to brain changes that challenge an addicted person's self-control and interfere with their ability to resist intense urges to take drugs. The recent reports issued by the United Nations showed that drug abuse kills about 200,000 people worldwide each year. They also revealed that global treatment for drug abuse would cost $250 billion per year if everyone who needed help received proper care, while fewer than 1 in 5 people who need treatment actually receive it. It is estimated that 1 in 20 adults, or 250 million people between the ages of 15 and 64, used at least one drug in 2014. Nevertheless, as over 29 million people who use drugs are estimated to suffer from drug use disorders, and of those, 12 million are people who inject drugs, of whom 14% are living with HIV. The impact of drug use in terms of its consequences on health continues to be devastating. Gulf countries are vulnerable to trafficking in cocaine, heroin, and other illicit drugs due to their geographical position. This emphasizes the need to intercept the illicit drugs and precursor chemicals as they move between ports in West Asia and Gulf region. Realizing such threat, Bahrain is among the countries that continue to combat drugs and prevent the crossing of narcotics to neighboring countries, as well as strictly dealing with drug dealers in accordance to the law. In fact, the kingdom has one of the strictest anti-drugs law in the region. In 2011, Bahrain launched Together Against Violence and Addiction program, which stems from the Drug Abuse Resistance Education program D.A.R.E. Bahrain was the first Arab country to adopt the US-based D.A.R.E. international program, which is already in use in 55 countries. It involves training community police officers to go into schools and teach students to resist negative influences and encourage them to lead safe and healthy lives. The initiative involves not only combating drugs, alcohol and violence, but also promotes civic engagement. Bahrain, along with all their members, strives to create a world in which students everywhere are empowered to respect others and choose to lead lives free from violence, substance abuse and other drugs behaviors. A vital mission to fulfill a vision.
With us here in the studio is Mr. Amini. Thank you very much for joining us today.
Thank you for having me.
We're going to immediately go straight to the subject because drugs has been an issue faced all over the world. But how do you see the current status of combating drugs on an international level?
Well, the term drugs can be defined in various ways depending on the country that you come from. Now, let's take GCC for instance. The term drugs refers to certain chemical substances and illicit opiates and the chemical precursors. So if we compare this to the West, it's including what I just said, plus they add over-the-counter medication and prescribed medication and anabolic and cortical and androgenic steroids. We're facing an epidemic actually when we talk about drugs, because it's a very tempting market.
Yes.
Now, if we look at the black market of the drugs, and we just take the opiate market now, the opiate stands for opiate, morphine, and heroin. Heroin is the most profitable. So heroin's market value is $55 billion US dollars.
Okay.
Now, if you take the whole opiate family, that's $65 billion. So this is just giving an indication of how tempting the market is. So, I mean, with that, we're going to have some unethical transactions and moves by people who want to make money.
Yes.
And therefore, I mean, we're facing an epidemic which is killing our youth. So every country has to take the precaution to, every country has to take a precaution to save their youth. And prevention is the main way to do that. Now, we got around 15 million people using illicit opiates worldwide.
When it comes to the drugs that you just mentioned, I mean, over-the-counter drugs, even things that are provided at the hospital that actually don't have any bad side effects, but when combined with something else, they might have. We also see that people, you can't really say those are that they are youngsters, but lots of people are coming up with very innovative and creative ways of getting to the feeling that they want, whether it is euphoria, whether it is wanting to go down, whether it is they want to go high. How is it? Is that the same way all around the world? Is that a problem?
Yeah, well, if you talk about globalization, it means that everybody's part of the globe, so we are part of that as well. So whatever happens in another country is going to happen here eventually. It's just a matter of time. And if we look at any internal security organization or an entity, the way they fight crime is number one, it's prevention. Number two, it's combating and enforcing the law. Number three is rehabilitation. Now, if we look at number 2 and 3, those need resources financially and humanly, which cannot be even forecasted. But when we talk about prevention, it means that we're going to save people before they fall in the crime and commit it. So the best way for all governments around the world is to protect their youth by providing prevention programs.
Yes. And Bahrain is actually one of the first, or is the first Arab country that has adopted and implemented the principles of a US-based prevention program called the Drug Abuse Resistance Education. Also short, it's known as D.A.R.E. Can you tell us more about D.A.R.E.'s initiatives and how it started in the kingdom, and also about its relationship with Maan, or Together, the other program? So,
well, according to the National Charter and the Reform Project by His Majesty the King, the birth of Community Service Police was by Lieutenant General Sheikh Rashid bin Abdullah Al Khalifa, the Minister of Interior. And the purpose of that was to come up with a form of police that serves the community. So we had the Community Service Police in 2005. And part of their job was to do the awareness campaigns and prevent crime. So what happened was in 2010, His Excellency Sheikh Abdullah bin Rashid Al Khalifa presented a program to the National Committee of Combating Drugs in Bahrain, which is chaired by the Minister of Interior himself and Minister of Education, Minister of Information, and Minister of Health, with other high-caliber, high-ranked officials.
yes.
So the program was for police officers to teach an academic program in the schools which teach students how to make the right decisions. And that was the D.A.R.E. program. So that was initially how we started. And after that, in 2011 was the graduation of the first batch of the D.A.R.E. officers, and we started entering the schools. And at this point, we have over 100 officers covering over 100 schools all around Bahrain, which is around 44% of the total number.
Yes. Can you tell me why it's important that they are police officers who give this kind of education and not just some educator at school? Why is it important that they are police officers?
That's the requirement from the D.A.R.E. organization. So D.A.R.E. started as an American-based program, but it's an international program today.
Yes.
And it started just to fight drugs, or just to prevent drugs and tell the students about how to avoid drugs. But today it's a decision-making program. It's a life skill program. So what the police officers do in schools is they teach the students the skills they need to face the community's challenges. So these are challenges they're going to face in life anyway, but it's a matter of time. So we try to teach them how to make the right decisions and see the options, and we don't actually spoon feed them. We make them derive their own perception from the situation.
Beautiful, yes. And I guess it also helps that policemen in all societies are looked as power figures as well as decision makers, making the right decisions at the right time or at crucial times.
Yeah, the difference of having a uniformed law enforcement personnel teaching the curriculum is significantly different than having a civilian do it. So I mean, we've
Exactly.
seen that, and we've even seen the attention of the students with the police officer. So yeah, that helps a lot, and that's something. I mean, it was a minimum requirement. It was a requirement from the D.A.R.E International, and once we implemented it, we knew why they did that.
They got excited about it too. Well, we know that, or what are the indicators that you feel have shown that D.A.R.E was successful in Bahrain? We've known in the D.A.R.E is in over 55 countries worldwide. Bahrain is the first Arab country to adopt it. And now we want to know what indicates that D.A.R.E has been successful in Bahrain.
Well, D.A.R.E started in 1983. That's over 3 decades. So having it been continuous, up to date, means that it is a successful program. We've been doing it for the past 6 years, and we got 2 main indicators that shows how this program is successful. First of all, we see the feedback of the school faculty and the parents. I mean, when we initially started in early 2011, it was hard to get police officers in schools because they didn't know what was his role exactly, and they didn't know, like, why was the police officer full-time in the school, because they're dedicated police officers. So they go to school, I mean, with the rest of the school faculty member, and they leave with them as well. So with time, they saw the interaction between the children, they saw the change in their behavior, they saw the skills that they grasped from the police officer, and even the school environment actually changed. So what happened was, I mean, I told you that we're just covering 44% of the schools in Bahrain. So we have a lot of schools that we're not covering yet.
Yes.
The phone calls never stop.
Beautiful.
From everybody, and the parents, and we got other directors from different ministries, and the school faculties just keep on calling us and saying that we need a police officer to be there. So that's number one. And number two is, we see the interaction between the students and the police officer. The concept was of the police officer to go in and teach them skills and break the barrier between law enforcement personnel and the community. So today what we are seeing is that the relationship between the student and the police officer is a friendship relationship.
Beautiful. Yeah. Because police officers are community servers, and that's always forgotten. But you just mentioned you guys haven't been at all schools. I know for a fact that you've been at a lot of private schools mainly. Did you go to public schools, or is that your next step?
We're a country that teaches the curriculum bilingually, so we do it Arabic and English. I mean, we've done it in public and private schools. The total number is 106 schools, 17 being private, and the rest are governmental schools. And we're just expanding and trying to cover that by the end of next year, maybe.
Yes. When it comes to training or choosing your D.A.R.E officers, because they're going to teach people or children of different ages, they also have to have some kind of characteristics that is able to teach. Do you guys choose them based on certain criteria?
Yeah, we got an initial interview that happens, and later on they go through a training, and that training defines if he's going to succeed or not. So him succeeding means that he's going to be a D.A.R.E officer, and if not, then he goes back to his police department. So the training has certain criteria, and it has a lot of exams that they have to pass, and they have field work that they have to go in schools and teach, and they have to pass so they can be a D.A.R.E officer. And that training takes like 2 weeks, and it's a very intense training, and we've been doing that for the past 6 years. And along with that, we have become a training center as well. So today we can do it internally without bringing trainers from over the States, and
to like train the trainers.
Yeah, so that was what we were doing. For the past 6 years we had like 9 trainings, and as we were doing the trainings for the police officers, we were even training trainers. So today we have double the minimum requirement of the organization to be a certified training center, and we have been officially announced the regional training center for Asia and the Middle East.
D.A.R.E has successfully entered school system in Bahrain and all around the world. But we also know that D.A.R.E comes with several institutions that cooperate together in order to have a good end result. What can you tell us about this cooperation? How does it serve D.A.R.E?
You know, our mission is to have a community free of violence and addiction, and our target audience are the students. So the program was designed in a way that in order for the student to make the most out of the curriculum and the skills that we teach them, there are three parties that have to be involved. So first of all is the police officer who delivers the curriculum. And second is the school faculty who makes the environment adequate for the student to practice the skills that he learned. And thirdly, and the most importantly, are the parents. So we have a lot of out of the classroom activities and homeworks that they take home, and there are activities that they do them with their parents. So parents are aware indirectly all the time what's happening, what are the trainings that they are taking, what are the skills that they are learning, and how to practice them in real life and with the help of their parents.
Yes, yes. And how does the neighboring GCC states or other Arab countries benefit from Bahrain's experience in implementing such a program?
Now, as I mentioned, we are a certified regional training center, and we have done the study, the translation, the research and development, and we've altered some of the lessons to meet our culture and religion, and we've added some of the negative behaviors and the phenomena that we faced in the community, which is, more or less very close to the neighbor countries.
Yes.
So every other country has a prevention program, an in-house prevention program like we used to do.
Yes.
But this one is a complete curriculum. It's a sequenced, scientifically based theories that the student is going to benefit from the skills that he's going to learn, and that those skills were built against the situations and the challenges he's going to face in life. So what we can do is we can train other countries' officers to be their officers, either by sending our staff or them sending their staff here.
Yeah.
And to start doing it, we know we did it from scratch, so we know how to do it. We can help any country in doing that. And even if any of the neighbor countries contacted D.A.R.E International, they're going to rewrite them to us.
Yes.
So we're the official
People
training
in
center
the
here.
GCC,
Yes. And in Asia and Middle East.
Beautiful. It's very important to know that D.A.R.E does not only target drug addiction or drug abuse, but also Maan, the program that was initiated in 2010, is a program that targets any kind of problems youngsters have while growing up. We mentioned before when we talked, bullying is a big problem that is faced in schools and in institutions around Bahrain, the GCC, and the whole world. And you guys also deal with that. As you said, it's a decision-making process that you help the students take. How does that happen, and what kinds of things do you deal with?
Now the term D.A.R.E stands for Drug Abuse Resistance Education. Now, like I said, that was in 1983.
Yes.
The term remained D.A.R.E, but the curriculum changed entirely. So it was just let's say a session about drugs.
Okay.
In 1983. Today it's life skills. Today we teach them how to face the challenges that they're going to be exposed to in life. So bullying is one of them. Theft is one of them. Peer pressure is one of them. Now, with the new technology, we got cyberbullying, we got fraud, we got how to use your credit card, how to use the social media, and then addiction. It's not referred to just drugs. We got smoking, we got drinking, we got video games, we got phones.
Yes.
So all of those are addiction. So we teach them. We teach them that you're gonna know that you're addicted and you want to quit. So what are the ways, and what are the how do you make the decisions?
Yeah.
Now, we got a segment in a very important segment in the 5th and 6th grade, which is called the D.A.R.E Decision Making Module, or DDMM.
Okay.
So that's a period that we teach the students, if they face a problem, like any kind of problem, how do they tackle it? How do they evaluate it? And then how do they derive the options that they have to execute one out of those, and then they execute whatever option they chose, and then they evaluate it. So we're not giving them answers.
Yeah.
It's not like regular training. It's not the orthodox training.
Yeah.
It's a new era based on theories that explain how the brain works. So understanding the brain, how it works, and how the children grasp knowledge, starting from 0 to 6 months and going upwards. That's how the curriculum is written and based on. So this is how we teach this.
So it's like an interactive module that basically the students talk with each other. Maybe we have debates or classroom activities.
It's an acting activity, actually.
Okay.
The skill that we teach them, which takes like around 20 minutes, then everybody gets up and they do modeling of whatever they learn. So whenever they face the problem again, whatever they're going to do, it's not their first time, because they did it the first time when they were modeling it in the classroom.
Yes. Well, let me ask you one thing. We know that you guys provide the service for these students and for basically children that are still in school. But how about people that have gone to college and grown up and they would have benefited from a program like this? Can they seek help?
Well, college is another place that we're trying to tackle and we're trying to get in, and we'll be successful in like another maybe couple of months or so.
Yeah.
So yeah, colleges are like, we're talking about students from 18 to 22 mainly. So again, there's the teaching terminology will be different. I mean, the methodology of delivering the information is going to be different, and that's an age where we have to talk more about the law and the penalties that they're going to face if, I mean, they do certain crimes, and they have to know what are the crimes, because a lot of people do things that they don't know it's considered as a crime.
Exactly.
So we're working on the curriculum, and we're doing the administration work with the colleges and all, and we're close to that. So I mean, this program is targeting students. I've been saying children and students.
Yes.
And unfortunately, that's it. I mean, whoever is not a student, they're not going to cover them.
Yes, yes. Well, but for a fact, Bahrain has been collaborating with countries and international organizations in combating drug abuse. What are the main agreements signed to serve the purpose of combating drug abuse?
Well, we have signed a lot of agreements, a lot of memorandum of understandings. I mean, starting with the United Nations till, I mean, the neighbor countries. I mean, the signature has been done by His Excellency the Minister, by His Excellency Sheikh Abdullah bin Rashid Al Khalifa, and by the Directorate of Anti-Narcotics. With, I mean, in regards of lab testing, combating drugs, field work, exchanging information.
There's a strategy that came out in June 2015
Yeah,
as well.
yeah.
Can you tell us about that?
Yeah,
in regard
the
to-
strategy was a result of the National Committee for Combating Drugs, which is chaired by His Excellency the Minister of Interior,
Yes.
and the members that I just mentioned, Minister of Education, Minister of Information, Minister of Health, and Minister of Youth and Sports, and a group of high-ranked officials in the
Yes.
country. And that strategy was to combat drugs in the terms of supply and demand. So that's again the fruits of that committee, and it's put in place, and it's taking action, and it has been shown significant changes in the indicators that shows the amount of drugs being in the market, and the side effects that affects the community. Like if you look at the number of fatality of overdose, that's a
Yes.
very good indication to show, I mean, what's happening in the country. At a certain point of time, we were like mid-20s and mid-30s maybe. Last year we had just 11.
Okay.
So that's a significant drop.
Significant
Yeah, and
drop,
that shows you I mean, all the entities and all the parties that are working to combat drugs and how their work is efficient.
Yes, these are not just local entities, but as we said, these are also international organizations that are combating drug abuse. And basically why it is an international organization, or why this is a global issue, as you said, is because the way drugs move from one place to another are through borders, are through the people that come to our countries and so on. So basically that's why the involvement of international organizations is very important, because they're the ones that put the standards that have to be followed in the policies. So there was an announcement recently which issued issued about a nationwide anti-drug campaign that is expected to reach about 300 schools across the kingdom by the end of 2017. Can you tell us more about that?
Yeah, I mean, this is the number of the educational institutions that we got in Bahrain. It's 300. So our target was to cover all those schools. And it took us a bit of time to reach like 44% because we were not a training center. But today, I mean, as we are a certified training center, we can do it in-house, and it can be done much faster. So by end of next year, we're hoping to cover the 300 schools.
Yeah.
I mean, the 300, we start from kindergarten. We start from kindergarten going up to colleges.
Hopefully.
Yeah.
Well, let's just put D.A.R.E. D.A.R.E. is there, and we know that is a student-based program to teach students and everything. And let's look at Maan. Maan has the same concept, but it is for our local society. It is tailored for our local society. Do you think Maan might be doing something more than just for students?
Well, Maan is there. Maan is just the let's say the Arabic version of D.A.R.E.
Okay.
Because we saw that there was nothing in Arabic. So when we took it, we didn't want to stick to the same name. So we changed the name into Maan.
Alright.
So Maan is a derivative from D.A.R.E., modified a little bit just to meet the cultural and religious aspect of the community.
Yes, yes.
And the program has expanded a lot. I mean, we've started just in schools, and nobody does it like us. Nobody has dedicated police officers in schools. No
Yes.
country in the world. Now, we're doing it starting from kindergarten, and we teach the students how to be safe. We teach the children how to be safe, starting from home all the way to the streets and to their schools and to their relatives' house. And then as they grow up, we grow up in the information. We give them more information, and we expose them to the things that they're going to be exposed,
Yes.
and teach them how to avoid, negative aspects of whatever they're facing, and how to keep their friends without doing anything wrong, and how to be popular in school without having to smoke.
Yes. All right. I think it's very important that we even mention what kinds of things they were going to be exposed to. I mean, we've talked about over-the-counter medication that's already available, but there are also things out there that parents will not immediately recognize, for instance, harmless medications, so as they say, but that are combined with a certain beverage or combined with a certain other medication might even prove to be fatal, not just give them that high effect. So what can you tell us about the different types of drugs that are being used in the region or even internationally? But let's talk about our region here, because we're talking to our viewers here in Bahrain.
Okay, so if we look at our country, geographically we're positioned in the planet, in a place where we got countries surrounding us producing narcotics,
Yes.
and agricultural method, and chemically produced method, and in trafficking.
Yeah.
But all the stakeholders are doing a great job in keeping Bahrain so safe. And
Yes.
as I mentioned, the indicators, it's clear that
Definitely.
where we stand. And if we look at the UN report, we're basically non-existent there,
Yes.
which is a very good thing.
Yes, it is.
So we know that our children are exposed. So what the government has done and what Ministry of Interior has done is bringing over this educational program
Yes.
to cover the prevention part, which
Yes.
is going to save us, our youth, in the
Yes.
future.
Yes.
And the other aspects that you're talking about is whatever they're going to get exposed from their friends.
Yes.
First of all, we teach them how to avoid those kind of things.
Yes.
We teach them how to overcome it and stay friends with the rest of their friends, but not do the wrong thing. And even if their friends are putting pressure on him, and we teach them how to deal with peer pressure. So basically, the student ends up being fortified with a lot of skills that he can face whatever
Yes.
challenges he's going to see in school. And
How
community.
about equipping the student with being himself an educator, helping a friend that might be doing something, maybe try to bring him into the D.A.R.E program if it is not available at his school or so on. Do you guys have something like that where you can tell them, okay, you guys can come to us for help?
Yeah, what they are doing is, I just remember something happened. It was a girl who found a wallet in the street. So she took the wallet, and the next day she gave it to the D.A.R.E officer in the school.
Okay.
So this shows their relationship and how they see the police officer there. So if the students see anything wrong, either in their school or out of their school, or even sometimes what they face in home, they feel much more comfortable with the D.A.R.E officer compared to the rest of the teachers. So that's where we get a lot of information. We try to solve things within the school with the parents, and sometimes things happen that the parents don't know.
Yeah.
So that triangle that I just mentioned, the three parties that have to be
Yes.
involved, they have to be involved. Otherwise, the program is not going to work, fully, and
Yeah.
and the student's not going to make the most out of it. So, involving the parents is always important. So sometimes we have parents coming to us and telling us, well, I have a problem with my kid, and he cannot do this, or he cannot do that, or he's doing this and he's doing that, and I don't want him to do that. We try to tackle that as well, and we try to come up with a training material, and try to focus on him among the 30 students without him realizing.
Yes.
And we see a lot of behaviors change.
Okay, beautiful. You mentioned it before, the types of behavior that you that is there and that children are facing nowadays are also things like cyber crimes. Is that also somewhere where you would show them ways of better using social media, of maybe not stigmatizing certain people, or how that could hurt other people and so on?
Yeah, we start with sharing sharing information.
Yeah.
So we tell them what kind of information should be shared and what should not be shared. And then we tell them about going online and what is social media, what is buying online, and what is chatting, and what are the restrictions, what are the things that they have to do and they don't have to do. I mean, we've got the Cybercrime Directorate, and we can see a lot of issues happening, children and adults.
Yeah.
I mean, the adults, that's the Cybercrimes Directorate's job to do that, and they're doing awareness campaigns for the adults. And the children, we're teaching them how to be safe on the internet. And that's been going on for the past 3 years. And as they face issues, they come back to the police officer and say, I mean, this guy talked to me this way, and this guy told me this. And so we see the interaction, and we know that it is useful. So if he had not learned that concept, he might have given out the information. And we might have had a disaster. So, I mean, these are again, another key indicator that we see how the program is successful.
Yes, yes. It's essential to prevent youngsters from the dangers of drugs, of bullying, of violence in early stages of their lives. In your opinion, what is the right age to inform a child about that, and how can parents contribute in spreading awareness if they're not from with the D.A.R.E program, but how can they contribute to spreading the awareness?
I mean, we start from kindergarten. So we didn't talk about drugs. We start from kindergarten. We tell them about how to be safe, and we take that gradually, because it's a sequenced work. I mean, we cannot just. It's not just a session that you do it. It's a skill. It's things that they have to learn gradually. Things that they have to build up to be able to do it. So the schools that we're covering, I mean, we're covering them, and we're continuing with them. And the ultimate goal is to cover all the schools. Now, if there is a certain need in a certain school, we got another team, which is the awareness office, and they got like 5 police officers as reserved, and they just attend to schools that we don't have a D.A.R.E officer. So that's the contingency plan at the moment.
That's beautiful. And how about parents? When should they be talking to their children about this if they cannot be in a program like their program?
Well, we have a program that we do beginning of each semester. We bring over parents, and we do it in the schools, and they get an idea on what are we going to teach them, and the cruciality of them helping them on the homeworks. So they basically know what is their role and the whole concept of the curriculum, and even on the like what they call them, the open days. Then I mean, the police officer is always there, and part of his job is to tell the parent on how he's doing on their curriculum.
Beautiful. All right. One thing, Bahrain has very strict rules when it comes to prescribing certain medications. These rules don't apply to all the countries, but in Bahrain they're very strict when it comes to giving out these prescriptions. What else can be still done in order to intensify these policies in order to keep children safe and even adults in the future?
Now, if you're talking about the prohibited list and the prescribed medication, I mean, this is something that's done, I think, by the NHRA, and they're doing a very good job. But this will keep continuing. It will never change, because as soon as something is on the banned list, the black market is going to come up with something else. I mean, we have the chemical precursors. That's something that, I mean, it's very hard to be controlled, because it's just, manipulating with the shape of the element. And I mean, we can put certain substances on the ban list, but there are new substances that are going to come out. So it's a never-ending story. But that job has to be done. As I said in the beginning, the main way to save our youth is prevention. I mean, we don't have to wait for the problem to occur. We don't have to wait to see our children addicted and then enforce the law and then start doing the rehabilitation, which, I mean, there are things that are not guaranteed. I mean, we cannot forecast the financial, the human resources that's needed to do this successfully. But prevention is initially the best way, which requires minimum financial and human resources.
Yes, yes. Mr. Amini, what are the upcoming events that are scheduled or scheduled for the future?
Well, I think we've mentioned most of them. We want to cover like all the educational entities in Bahrain, and getting into colleges is a big thing. And as we're a regional training center, we're trying to get it, I mean, to begin with in the GCC countries and expand to all the Arab countries. This is just to begin with. I mean, but with the Arab countries, we have the benefit of the language, because we made the program in Arabic, and even the training material. So we can do all of that. And
are you planning any awareness campaigns locally?
We do the awareness campaigns on the 26th of June, which is the International Anti-Drugs Day, and we've been doing that yearly, and every year we have a different concept and different approach, and we're targeting all the stakeholders to combat drugs. I mean, what we did last year was something for the parents. We built up a teenager's room.
Okay.
And that room had a small door, and only parents were allowed to come in. It was done in Sif Mall, and we had the children staying outside with the police officers and just using paints and with the coloring books and all. But only parents were allowed to go in, and they were explained to, like, an average teenage room would look like this. But there are certain indicators that shows that you know, informs you that your child is using something. So even if you see like books, I mean, on the shelves, you got to make sure they're books. If you see like certain tobaccos on the ground, you'll say that my son is smoking. Yeah, but your son is smoking tobacco, so the tobacco shouldn't be on the ground. So if the tobacco is on the floor, it means that he took out the tobacco and put in something else. So if you see a spoon next to, and the spoon is burnt next to his bed, that again is an indicator for something else. And we had also a sort of a candle which had the smell of marijuana, and that gave them an indication just to know what is the smell, because, you know, I mean, parents go in and they say, yeah, I know my son is smoking. Yeah, but are you sure it's just a normal cigarette? Yeah, so that was a...
That's an interesting activity. Hopefully this year in June you guys have something also planned up.
It's this, I mean, we were directed by the National Committee of Combating Drugs to expand this exhibition to all the governorates, because we did it only in the capital governorate, in the Sif Mall. Yeah, so we have to do that. Plus, we're working on whatever is coming for June, and we got some new things, but I don't want to like expose them now. Yeah.
Okay, that would be great. All right, I'd also like to ask you if anybody wants to get in contact with your institution in order to ask any more questions, or for instance invite you over to their institution, educational institution. How can they get in contact? On the website, on number?
They can call us. I mean, anybody, if they see any police officer, they can just tell them like, how can we contact D.A.R.E? And it can come to us through the ministry, through any police station. They just go there and tell the community police service that we want this program. They'll give them our office number, and they can call us anytime.
Okay. Is there anything that you'd like to add now at the end of the program?
Yeah. First of all, I would like to thank His Excellency Lieutenant General Sheikh Rashid bin Abdullah Al Khalifa for the unlimited support that we're getting, and this program wouldn't have happened without him.
Yes.
And secondly, I would like to thank His Excellency Sheikh Abdullah Rashid Al Khalifa, who is the father of the program. And I would also like to a big thank you to the stakeholders. The stakeholders are Bahrain's population. Everybody's a stakeholder to save our children.
Thank you very much for being with us today. And we would also like to thank you for watching, and see you next week in another episode of Inside Edition.